Welcome back to DemButlers. I'm Cass, and Dub is back there in the background. He's on camera duty, but he'll poke his head in a minute. And y'all know one of the things that Dub and I have continually been talking about is our health here in Panama. It has just gotten better. We're slimmer. We're looking good. We got the Panama glow. Everybody's always asking us, what are y'all doing? What are y'all doing there? Y'all aging backwards? Well, one of the things that we're doing is utilizing this company right here, Theta Salud. Please know this is not a promo. This is real life. We're actually here going to get some IVs at their new location, and we're going to take you around and let you see everything. But we have utilized them in the San Francisco office, the Costa del Este office, and now the Casco Viejo location. They are here in Old Town, which it couldn't be any better. And I'm going to pause and let everybody introduce themselves behind me, and then we're going to talk about the services that they offer right here in Casco Viejo. So, all right. Who am I speaking to?
Hello, I am Dr. Anjali Cobham. I'm the doctor in this clinic that just opened last week.
Last week.
Yeah.
Okay, and go ahead.
Lisa, I am the manager.
The manager, Laisa.
Lisa.
So in case you couldn't hear, because she's not mic'd up. And just in case you hear the church bells going on behind us, that tells you we're in Old Town. We're in Casco Viejo. And every 30 minutes, you're going to be reminded of services in Catholicism. So you just need to know it. We're truly here. We are going to give you a tour and show you everything. Now, I'm here for IV therapy as well as Doug, and we have continued to get those while we've been utilizing Theta Salud.
Okay.
It's ironic to me that one of the services that you offer here in Casco Viejo is IV therapy, because if you don't know, Casco Viejo is known for partying.
Exactly.
It is the nightlife of Panama. It's the area that never sleeps. Mm-hmm. And sometimes people can travel here and get a little
dehydrated,
may consume a little too many of those fruity drinks.
Yeah.
And need a little bit of a refresher.
Exactly.
So do you mind telling, first off, when did this location open?
It opened last week around Monday, I believe.
So this right now currently is February, what is today, 11th? I get lost on dates. I don't know what today is, 11th, 12th? Yeah. So you've been open about a week.
Yeah, since February.
Since February you opened. This is Theta Salud's third location in Panama. Okay, what are the services that this location in Casco Viejo specializes in?
So we specialize in wellness care. So it's pretty much like a travel walk-in aid. So for tourists who have any dehydration, or if they need a little consultation, general consultation, well, we have a doctor here where we can see integral of their whatever they have, and pretty much prescribe them anything that they need or any IV therapy that they need. Also, we have peptide therapy.
What's peptide therapy?
Peptide therapy, it's pretty much, peptides are amino acids.
Okay.
So they pretty much, we have like 5 types of peptides therapy right now. We have the GLP-1 medications.
Okay.
If we've heard of them, pretty much they're famous right now in the States. They're known for
losing weight
and regulating blood sugar levels.
Okay. Yeah. So the GLP-1s is what you can also...
We offer GLP-1s, but we also have a BPC 157 or BPC 157 with TB 500, which helps with tissue repair. So you have
all of that's good. So tissue repair meaning healing,
tendons, joints, healing,
So arthritis sufferers.
Exactly, or osteomyelitis.
Anything bone and joint tendons. Okay, that's really good to hear. I need to probably be looking into that because I got a little tendonitis going on with my finger. Yeah, we're really in Old Town here. You're going to hear cars, you're going to hear noise, but we have our microphones on, so you'll still be able to hear us. So this one is more streamlined to IV therapy, peptide therapy,
and wellness care.
And wellness care. So a lot of the Theta Salud machines, the healing machines that you're used to seeing may not be offered here.
Yeah, they may not be offered here.
Okay, but it's quick. It's thinking about the people that are here in this area.
For this area, so they don't leave the area. They wouldn't have to leave the area since it's like the Old Town.
It's Old Town, all right.
There hasn't been a clinic around this area, so thank God we opened. And so it's pretty much like any person that needs like a travel, like they're traveling, they need to go, but they're feeling a little sick, or they feel like they're dehydrated and they need some therapy or IV therapy. Well, we have it here now.
Okay. And the hours? What days of the week are you open and what are the
Okay,
hours?
so we're open from Monday to Sunday
Okay.
from 10 to 6.
10 to 6.
10 a.m. to 6 p.m.
And are appointments needed or can I walk in?
This is a non-appointment place. You don't need appointments, but you can also take appointments if you want to do peptide therapies.
Okay.
Right? And have a little follow-up with us.
Okay. And if I did want an appointment or wanted to find out more about cost, is it better to WhatsApp or is this location listed on the website for Theta Salud?
Oh, it's listed already on the website. Also, we have it on Waze if you get lost.
Yes.
And
Yes.
yeah, no, it's updated.
Okay. And one of the things that I did today, which I really appreciated, was the fact that Lisa sent me the actual Google link as to where it is. And some people may not realize this. It takes a minute sometimes for your local location to populate in
Yeah.
Uber. It may take it a while for people to start coming
Yeah,
to there
exactly.
until they start actually transitioning here. So a little trick. Take that link and it's going to ask you that you want to open it in Google Maps, Apple Maps, or Uber. And you want to open it in Uber. And our Uber driver brought us right here, dropped us right off. So you don't have to fear. But again, that's if you need to actually drive here. It's predominantly listed for the people here that's
for the
at
tourists,
Costco,
exactly.
Casco
For anyone
Viejo.
who's staying around in the Old Town Costco.
Okay, I love that. So what are some of the therapies that are offered as far as the IV?
So we have 12 IV therapies offered. Pretty much they are vitamin immune, boost energy. It helps clean with the cleans in our body, illness recovery, dehydration. So we have hydration, the first top one.
So hydration. Oh, let's pause there. I'm sorry. This is just regular conversation. Now, most people don't realize that they're dehydrated because they think they're just tired. As a doctor, what are some symptoms that people should be looking for to not know maybe you're dehydrated and you need some hydration?
Pretty much when you have a little headache, when you feel weak, fatigued, pretty much it's your body telling you need to drink some water. So you're also in a tropical area where you need at least 3 to 4 liters of water. And most people don't even drink a liter. So,
they don't.
Yeah, most of the people are
3 to 4 liters, you guys. Think of the Coca-Cola bottles. Think of literally the liters of Coke or Dr. Pepper. So just think of those, and that is where you need to drink 3 to 4 of those when you're here. And you're right, most people don't drink a bottle.
And if you're around this area, you might be drinking more alcohol than anything. So we have the hydration for that.
I can attest to that. Maybe a couple of those $5 happy hours may get you. Okay. And then, so besides that, is there anything else like physically they can look at? Skin elasticity or?
So we have also Glow. It has glutathione, like 600 milligrams of glutathione, which is pretty much an antioxidant. It helps pretty much promote elasticity and collagen. Sorry, collagen.
I know it's collagen. She's trilingual, so hey, bear with us. We know a lot of languages here. She knows a lot of languages.
Collagen. So pretty much that one helps with firmness, skin glow. We have the Glow glutathione.
I like that.
Also, we have the Theta IV NAC detox. By saying the NAC detox, the NAC helps promote, synthesize the glutathione. So that one is much better than glutathione itself.
Okay, explain it a little bit further. I've never even heard of that one.
Yeah, sorry. It's new. So we have the NAC detox. It helps detoxify the liver. Plus, for whoever has fatty liver or something like that, it helps with the detoxifying of liver.
That's good.
And it also has NAC, so it synthesizes glutathione.
Okay.
So instead of just having glutathione for 2-3 weeks, having a skin glow, you might have it for a prolonged time because you have the NAC that synthesizes it.
So there really is, although I call it the Panama glow, really and truly there has been some extras that have been in our IV therapy that really has been providing us with better skincare.
Yeah.
And when people keep telling Cedric and I that we're aging backwards, no, they've been saying that because we've been utilizing Theta Salud for pretty much a year. I mean, it's like about 10 months. And we feel our overall health has improved. I mean, we're major proponents. We felt it.
I see it.
Well, thank you. And people, they're actually seeing it. They're seeing that we actually look better. We sound better. The weight loss is good, but there's a glow.
Yeah.
There's a glow about us. And so when your under eyes are clearing up, when your skin is getting better, when the wrinkles are leaving, those are things that we can
that
get
we
a boost
see.
up. You can
definitely
see
see them with the IV therapies that we have
Okay.
in hand. We also have the Myers cocktail, known and made by Dr. Myers. This Myers cocktail is pretty much known for its nutrition. It helps with immune system. It helps for people who can't orally consume it.
Mm-hmm.
Well, IV, we have the IV. It's pretty much a fast acting, and we have the results are pretty much quicker than
that. Okay.
So so it has 15 also amino acids.
Wow.
Yeah, it has a lot of amino acids. It helps with the nutrition in general.
Okay.
So it's a boost of energy. People feel more energized, more
refreshed
from the
Yeah.
brain.
Yeah, they can think, they can focus.
They can
Oh, just-
focus,
They're not sluggish,
exactly.
and they can actually focus.
Yeah, for
How long? I heard you segued to it, and it was perfect. How long does it normally take to see the results of anything you take IV therapy wise?
Well, the best thing it would be to have a little bit of consistency, maybe once a week or every 2 weeks, or at least once a month,
Okay.
because we are always deficient in vitamins.
Right. You just can't take enough. Even by food.
It's just never enough. I think it's always better to be just consistent so you can see the results. I mean, definitely in the first try, you feel different. You feel a little bit more energized. Even sometimes, even if you have a headache, it's gone. You feel really hydrated because in the end, we're giving you saline. So it hydrates you. It has electrolytes for it. But yeah, no, consistency. It's
Okay, and I'm glad you said that again
answer.
about the hydration. So a lot of people don't even realize that. And this is a doctor, you guys. So we're going to talk doctor here. We're going to talk doctor knees here for a minute. A lot of people don't realize when they go to the bathroom, we all urinate. Your urine should be a certain color.
Exactly.
And if it's not that color,
then we are dehydrated.
then we're dehydrated. And what should the normal urine color scale be? I know the answer, but I just want everybody else to kind of hear that.
Pretty much kind of transparent.
It should be clear lemonade.
Clearly, yeah.
Clear lemonade. So for those of us from the US of A, clear lemonade.
Clear lemonade.
Clear lemonade. It shouldn't be orange. Shouldn't be
Shouldn't be
tangerine.
yellow,
Shouldn't
no.
be yellow.
No, we don't want that.
Yeah.
No.
Now, depending on what IV therapy you use, after you get IV in your body, it might turn a color as you're passing the.
Oh yeah, for
stuff.
example,
Yes.
the B complex vitamin IV therapy, it can give you like a little yellow color after you did this IV. So
Yeah.
people get scared. They're like, oh my gosh,
What's going on?
What's going on? I'm dehydrated, and it's not that way.
No, it's
just
not.
like, just gave you that coloring.
Yeah.
Just keep on. Don't worry. Just continue drinking water. You got hydrated, and that
It'll
color
flush.
will change.
It'll
It will flush.
It'll flush.
Definitely.
So there. I think it's 500 milliliters. Is that right? And what's the other?
We have between 500 milliliters to 1,000 milliliters, right?
Okay.
It depends on which therapy you pick or you decide. But you can also add in 1,000 milliliters more.
Wow.
So if you decide having the hydration with 500 milliliters and you want to add a little bit more of hydration, then there's also that option. We can give you 1,500 milliliters of IV therapy.
Now, I know my mother is one of these people. She's afraid of needles, doctor. She's afraid of needles. She's ghastly afraid of needles. I'm not saying anybody should love needles. That probably is a little weird if you love needles.
Yeah.
But she's afraid of them. If she sees one coming at her, she's running out of here.
Okay.
What are the options? I personally get mine in my arm, and I know Cedric, for whatever reason, he's lately been having to get his in his hand, and I don't know why, but it is.
Okay.
What are the options for location, I guess? Do you adjust for people that maybe have heart veins?
The best options definitely is in the hand or in the upper arm right here.
Okay.
We don't really have another option between those two places because we need the patient to not move, and we also need the nurse to supervise.
Yes.
So it's a place where it is an easily place to go to.
Okay.
However, the hand is
hand is the fastest.
Yeah, it's the fastest one actually than this one because we're always moving this.
Yeah.
Right?
Even when you're sitting there.
Even when you're sitting there, you're using
On
the
the
phone, and it's
phone.
fine. Like, your hand is always going to be pretty much a static, but this one is always moving. So we
Okay.
generally always try to do it in the hand. But obviously, we have other options, so don't worry. It's just
Okay.
like
So,
that.
and I think I've seen different size needles depending on where
Yeah,
it goes. So
also.
for the,
Depending on the size of needle, it's a little thinner or a little thicker.
thicker, depending on where it's
Yeah, depending on but we always try to give the thinner option, obviously, so that our patients don't feel any pain. We
Right,
don't
and
want
you
them
don't.
to feel any
You don't
pain,
feel any pain.
right? And we also have the nurses capable to giving the IV therapy. So yeah, we
You're
have
good with that. About how long should one plan in their day if they come for, let's say, the 500 mil? How much time should be set aside for you to have the complete experience for the therapy and not be rushed?
I would say always 2 hours.
Okay.
Some IV therapies are passed in an hour or two, but sometimes we have to give it, some we have to pass it slowly because it might burn a little
Okay,
bit. You might
okay.
feel like a burn sensation.
Like a burning sensation.
So that would take mostly like 3 hours.
Okay.
Maximum.
On the max.
On the max. The slow IV therapies, but everything else between 1 and 2 hours. Yeah.
Okay. I love hearing this. And so,
So it's a place of
it depends.
relaxation. So please come.
Relax.
Relax 2 to 3 hours where you just don't have to think and do something afterwards because this is
Okay,
about
now
your care.
this Casco Viejo, this party town. I come get an IV therapy, then I go right back out that night and I overdrink. Can I come back the next day and get another IV?
Exactly. Come back the next day. We'll treat you. Yeah, don't worry.
Okay, I'm just on this party town. And
Yeah.
some people are going to do that. And what is also not necessarily, I don't want to make it seem like that everybody that comes here, they're always drinking. What if some people also just get too much sun?
Yeah,
A little
we're gonna have heat strokes, definitely.
Okay.
If they get too much sun, well, we're here. We have little stuff for urgent cares,
Okay.
for injuries or anything. We're here for that.
No, like almost like a minor care hospital.
Yeah, minor care. Minor care. Because the thing is, if I have to refer to the hospital, well, we will refer to the hospital because this is, like I said, a travel walk-in aid. Pretty quick. Anything that you need to consult, we're here for it. Minor injuries, we're here for it. Heat strokes, we're also for the dehydration IV therapies. We have all of that for you. Even if you're vomiting, you're nauseous,
Yes.
we have an ondansetron. We have all of that for you too.
And also what I do like about it is that logically we're in Panama. Panama is a Spanish-speaking country.
Yeah.
But you do find people that unfortunately when it's a medical emergency, even if they speak un poquito Espanol, that kind of leaves their head when they're in pain and they can't navigate
and
through
they
it.
can't communicate.
And they can't
well.
come. So I do like the fact that there are English speakers on staff, including Lisa,
Thank
who's
you.
also an
Yeah,
English
we're
speaker.
ready for
She's
that.
you are ready. You're ready. And the doctor obviously is English speaking. So that at least helps
feel more
people feel
comfortable.
comfortable
Definitely.
speaking in their native language. But you are fluent in Spanish, and then it is also there is staff here as well.
Yeah,
that can
exactly.
help you.
So any person can come, any native like any native Spanish
Speakers
speaker or any native English speaker can come here.
and be totally assisted.
Yeah, be totally
I
assisted.
love this. Okay, and so I got all of the different IVs. Anything else that you would like to talk about as far as the therapies that are here? Is a recharge? Go ahead.
Yeah, well, we also have the mitochondrial blue, the methylene blue. It helps with oxygenize the cells, right? So it gives also boost energy, helps oxygenate, helps with the cellular energy. So yeah, we also have the methylene blue, but to take that you can't be an antidepressant. So.
Okay. So there are some things that
There's
you
some
just can't.
things that people can't take. Yeah. So anything we have here, it has to be evaluated by the doctor. And,
Okay.
Yeah.
She's
We
good.
also have these options of add-ons. Okay.
Add-ons. Okay. These are like
Yeah.
upgrades, a little bit different.
If you feel like you want a little bit more boost of vitamin C or vitamin B or zinc, calcium, whatever you want, we can add it on the IV therapy. Too.
Okay, and so a little extra. So some of the things that are listed there, you guys, are calcium, vitamin B12, vitamin B complex, vitamin C.
Exactly.
I don't
We
even
have
know what that one is.
Ondansetron, which is like for vomiting, nausea. For people who are actually like, I'm dying.
I'm sick. Like
sick.
I'm really sick.
Yeah, like they will get dehydrated. So we got that to control that first, then dehydrate with electrolytes and all that stuff.
Okay, and then
hydrate with electrolytes.
electrolytes. As far as form of payment, everybody that doesn't come here doesn't necessarily have Yappy because they're traveling, they're tourists.
Yeah.
Is it cash only? Is it major credit cards?
By card. Yeah, we can do card, we can do cash, we can do Yappy. So we have all the options too.
All the options are there. So you don't have to have Yappy. For those of you that are traveling, we realize you don't have a Panamanian bank. And so then I also noticed that there are some other, and we're going to go through those when we actually start going through the room. But I see some of the other items that are like available here. Are those prescriptions or what are those?
So no, we have the peptides there.
Just the peptides.
There's also an oxygen therapy that we give.
Okay.
We have a NAD, the NAD which helps with mitochondrial, because while we get older, we have less NAD, right? We create less NAD, which is what helps us with rejuvenating and
okay.
for that. So we
Okay.
also have transdermal patches, which is like the Vital patch and the Slim patch. It helps boost while you're on GLP-1. The Slim patch, it helps boost the.
And is it physically a patch? You put it on your body?
You physically put it right here.
Okay.
It's like a 30-day treatment. Every 8 hours, you're supposed to use it for 8 hours, and you take it off.
Now, I want to pause on the GLP-1s real quick. If the person is tourists, they're traveling here, are they able to start their GLP-1s and then purchase them and then take them back to their home country, wherever they happen to be? Is that an option?
We have that option. We have the option for you. If you're traveling, you can take as many that you need, obviously prescribed by the doctor, for it to go safe to your home country.
And is that, as I personally, the answer to this, that is TSA approved or FAA approved. I should say not TSA, FAA
FDA approved.
They give a pouch that you can carry.
Yeah, we have everything for you to carry. It's supposed to be also in cold, right?
In cold, refrigerated.
It should be refrigerated. So we handle that so you can take it to your country safely.
They have a written prescription in case you are inquired or asked about.
In the airport, if you have any problems, we have like a paper where it's supposed to consent that you can take that the doctor's prescribing it. So you shouldn't have any problems.
You're good to go. So for those of you that are possibly wanting to have better health, and I'm just going to say you come from the USA of America, and maybe that this might be another option that may be more affordable for you, that to pay and get that started here and then take your medicines back to said home country, because it's something that now you can possibly afford as an option. So, well, this is really good. I'm ready to get my IV started.
Okay.
Thank you so much, doctor. Thank you, Lisa. She did just fine, didn't she? She was concerned. Yeah, I already knew it as well. So the next video, we're going to actually do a walking tour. We're going to point out the different rooms, and then you're going to see Dub and I getting our IV therapies. We're going to have to decide which one we want. And so keep watching. You have more footage coming up. Thanks. Hello, doctor.
Welcome to Theta Salud.
Thank you so much. Oh, this is great. I love it, love it, love it. Okay, so what
do we have?
What do we have here? What am I looking at here?
So this is the nurse's station. Whatever I need them to do for IV therapies, I tell them what we're gonna do. Also, the peptides are in hold right here, and we have also the medications on this side.
Okay.
For anything we prescribe.
You know what I'm glad that I just saw, and I'm sure I probably could have asked this. You see where you have the container that you put the
needles?
The needles?
Yeah.
If after you do injections, if you have old needles, is this a safe place? Like if I'm coming here for therapy, can you discard your needles here as well? Or?
Yeah. All the needles here, we discard it because...
No, I'm talking about, can I bring mine, the ones that I've previously injected myself?
Then
you discard? Can you do that? I just wondered that. I'm always concerned about where can you put the needles. I don't want anybody touching.
We have the containers for that.
So you have the container? Okay, so this is the nurse's station. This is where they get you your good juice.
Yeah.
That's what I like to call it. And then we have beautiful Lisa here. Fully prepared there. And so Lisa is
our manager here. She will handle any question that you have. She will, if you come in, she will handle that.
Okay. So this is where payment is taken care of. This is where appointments can be booked.
Exactly. Any question that you have,
questions?
and price questions that you have, well, it's up here.
Is this number here, the 7952, is that to this location or is that to the main?
To this location.
So the WhatsApp is 6765-7952. If you're on WhatsApp, it's there. And go ahead. And the QR code.
We also have a QR code for any... for any communication.
Any communication. So I'm very quick on the return of WhatsApp, and I really like that as well. She's on it, handles it. Okay, and then we have the waiting area, sitting area.
Yeah, so this is the sitting area, the waiting area for any patient that we have in line.
Okay, and that's where they just sit and relax.
They can relax, drink some water if they need to hydrate with some water too.
Okay.
Yeah. So this is also, so we have this station of things that we sell, because we also sell stuff. For any patient that comes here and we don't have the pharmacy close by, or even antibiotics or anything, we have them too.
Right here. You know what? Does this actually say testosterone gel? So like men that have low T cell count, or that's what they can put. Like it's a topical.
This is testosterone gel, mostly for women.
Women.
Yeah.
Wow.
Women. Okay. Where you just put a little bit right here. and it does immune it. It helps
Internally, eliminate in your immune. Never knew that.
It is a treatment that we have here.
Okay.
For men, we have another treatment of testosterone. It's just
It's a different one.
yeah, it's a different one.
And then this is the patch that you were telling me about.
Here, testosterone injection. We have the here.
Okay. Because men have to actually get injected.
Mm-hmm.
Okay.
Exactly. We also have, even if you have muscle pain.
Yes.
Torticollis or something.
Okay.
Like that. Well, we have also transdermal patch.
So it's almost like the heat patch.
Yeah, the heat patch.
The heat patch. Okay.
No, sorry, it's not a heat patch.
It's not a heat.
No, it's a anti-inflammatory pain patch.
So good for does it? I'm not saying it's good for pain, but there's a lot of arthritis. We have a lot of. I don't know what the deal is about the U.S. of A, but we have a lot of arthritis sufferers. We do. A lot of us just suffer from arthritis. Is it? When you say pain, is it like muscle pain or is it internal pain? That's what I was. Okay.
Muscle pain, not internal pain.
Not bone and joint in muscle pain.
No.
Okay, I had to clarify because
Yeah.
you would be having a line out here for that arthritis. They'll be going, I finally got something I can get rid of with this arthritis.
So we have inhalers, Seroflow, Duolin, and Nestylin. If we have someone with asthmatic crisis,
yes.
we also have
Now
that.
that's good to know. If you forgot your inhaler.
If your inhaler, like you used up your inhaler, then we also have inhalers for you here. All kinds of options. We have the Vital Patch, like I was saying, and the Slim Patch, which are the transdermal patches. The Slim Patch would helps support patients are already on GLP-1.
Okay.
And the Vital Patch, which is full of nutrients. It helps with energy boost, also with nutrition because it has vitamin C, vitamin B, all types of vitamins. So
And then this is our therapy sitting area. This is where you actually get whatever the therapies are.
Yeah, so we have here all the sitting area for IV therapies, and also this area right here is just for IV therapies too.
Okay.
However, I do feel like this area will be removed to have a place like a what's it called? Private place for the
private
patient.
place.
Yeah, if they need like cleansing for their injury or an injection in
something a little bit more private.
that
you don't want to. I got exactly what you're saying.
Yeah.
So this will be changing. Again, they've been open about a week, so the layout and things will change as far as to appease the client and give them or the patient to give them a little bit more privacy as needed. And then this is of course the big room.
Yeah,
the doctor station.
So this is the doctor station. For the seating for patients, and here we're at my office where I will be treating you and consulting anything that you have.
Okay.
We also are going to take obviously the blood pressure and everything that you need. We have a glucometer for sugar levels.
Yes.
If someone comes here and it feels like their sugar levels are going down, then I will try to notice that and try to figure out if their sugar levels are high or low. So we have also that machine here.
Okay, I love. Now, doctor, I have to just ask because I want to know because I know others are going to want to know. Where did you receive your medical knowledge or expertise? Because I'm telling you, she was very nervous about her English, but English is perfect. You speak better English than I do.
I studied here in Panama. In Universidad Latina de Panama, which is like college, right?
Okay.
For 5 years. And then I did my internship here also.
Okay.
For 2 years to be a general doctor.
A general doctor.
I did my first year in el complejo hospitalario Dr. Arnulfo Arias Madrid.
Madrid. Okay, I heard that part. She said everything else real fast, but I heard Madrid. Okay.
And second year in el complejo Manuel Amador Guerrero, which is in Colón, because I'm from there.
You're from Colón.
Yeah.
She is local Panamanian, born in Colón. Beautiful country, beautiful area. I love Colón.
Yeah.
It's a beautiful
People are
area.
just amazing.
They are amazing. We have found some of the most, warming people.
Yeah, warming people. They're so lovely.
Who we've met in Panama have been from Cologne. So your home area is beautiful. So thank you so much. Well, we're going to get started. Thank you for the tour. We're getting ready to get started on our IV therapy. We're going to get a little bit of footage of that. And so make sure that you now visit the third location of Theta Salud right here in Casco Viejo.
We'll be waiting for you here. Please do come.
Please come. They're ready. So you shouldn't have to feel sluggish or dehydrated or not yourself. Don't let the rest of your trip or your stay just not be that great because you're not feeling good, there's an option right here in Casco Viejo that you
Super
can
close
walk
by.
over to. Yes, walk over to. Dub is going to even get the street for you so you can know what you're looking for.
Yeah.
All right, y'all. Thanks. Until next time, like, share, follow, comment.
Subscribe.
With that, we're out. Thanks.